NCLEX exam question examples with answers full practice test. Question 1. The nurse understands that the prescribed levothyroxine is effective when the client with hypothyroidism makes which statement? Option A. I still feel lethargic and fatigued. Option B. I have been having daily, formed bowel movements. Option C. I have to change my sheets in the morning because I sweat a lot at night. Option D. I was reprimanded at work after becoming angry with my boss. The correct answer is option B. I have been having daily, formed bowel movements. 2. Question 2. The nurse in the outpatient clinic is following up on a client with a fractured arm. The client's arm was placed in a cast 4 hours ago. The client states, my fingers are tingling and feel cold. Which action should the nurse take first? Option A. Apply an ice pack to the cast to reduce swelling. Option B. Elevate the client's arm above the level of the heart. Option C. Check the capillary refill in the client's fingers. Option D. Notify the healthcare provider. The correct answer is option C. Check the capillary refill in the client's fingers. 3. Question 3. A client has received instructions for the management of osteoarthritis. Which statement by the client would indicate a need for additional teaching? Option A. Early surgical intervention is the preferred treatment. Option B. Gradual weight loss may help my pain. Option C. It is important for me to balance my exercise and rest periods. Option D. I will avoid driving after I have taken cyclobenzaprine. The correct answer is option A. Early surgical intervention is the preferred treatment. 1. Question 4. A client who has osteoarthritis, affecting both knees, is reporting constant pain at a level of 4 on a 0 to 10 scale. Which non-pharmacological intervention should the nurse implement for this client to help alleviate the pain? Option A. Position the client with the knee joints in a flexed position. Option B. Provide opportunity for the client to participate in hydrotherapy. Option C. Collaborate with physical therapy for paraffin dips to the knees. Option D. Place the client on strict bedrest with bathroom privileges only. The correct answer is option B. Provide opportunity for the client to participate in hydrotherapy. 2. Soaking in a hot bathtub or doing hydrotherapy with physical therapy provides warmth that will decrease pain. The buoyancy of the client's body in water decreases weight on the joints, which will also decrease pain. Question 5. The nurse in the urgent care clinic is reinforcing teaching for a client who is being discharged with a new cast on the left arm due to a spiral fracture. Which statement indicates that the client correctly understands how to care for the cast? Option A. I will avoid using ice the first 24 hours that my cast is on. Option B. A moderate amount of daily drainage from my cast is expected. Option C. I will notify my healthcare provider if my hand becomes pale. Option D. I should be able to fit 3 fingers between the cast and my skin. The correct answer is option C. I will notify my healthcare provider if my hand becomes pale. 3. Question 6. The nurse is caring for a client who is experiencing an acute gout attack. Which action should the nurse implement? Option A. Monitor liver enzymes. Option B. Provide a high-protein diet. Option C. Restrict sodium intake. Option D. Administer indomethacin. The correct answer is option D. Administer indomethacin. For the nurse should administer a nonsteroidal anti-inflammatory medication such as indomethacin to help decrease pain and inflammation. Question 7. The nurse is reinforcing teaching regarding the use of methotrexate with a female client who has systemic lupus erythematosus. Which statement by the client indicates an understanding of the teaching? Option A. I should not use contraception that contains estrogen. Option B. I will avoid interacting with people in large crowds. Option C. Lab work won't be necessary while I take this medication. Option D. I will not take any vitamin that contains folic acid. The correct answer is option B. I will avoid interacting with people in large crowds. 2. Methotrexate is an immunosuppressant medication that is used to treat systemic lupus erythematosus, SLE. Due to immunosuppression, clients taking methotrexate should avoid large crowds of people to prevent becoming ill. Methotrexate should be taken with folic acid to decrease gastrointestinal and hepatic toxicity. Clients who are taking this medication should have a complete blood count test done regularly to monitor for decreased white blood cells and platelets, which can indicate bone marrow suppression. Methotrexate is teratogenic, therefore, pregnancy should be avoided while taking this medication. Question 8. The nurse is caring for a client with osteoporosis who has been prescribed alendronate. When providing care, which intervention would be a priority? Option A, notify the healthcare provider if the client reports jaw pain. Option B, monitor the client's serum calcium levels. Option C, encourage the client to increase their intake of vitamin D. Option D, administer the alendronate 30 to 60 minutes before the client eats. The correct answer is option A, notify the healthcare provider if the client reports jaw pain. 1. Question 9. The nurse observes an unlicensed assistive person, UAP, providing care to a client who had a total hip arthroplasty 24 hours ago. Which action by the UAP would require the nurse to intervene immediately? Option A, placing non-slip footwear on the client prior to ambulation. Option B, placing a raised toilet seat in the client's bathroom. Option C, standing by the client's non-operative side during ambulation. Option D, reminding the client not to cross their legs. The correct answer is option C, standing by the client's non-operative side during ambulation. 3. When assisting the client during ambulation following a total hip arthroplasty, the UAP should stand on the operative side, i.e., the side of the surgery, to help provide support to the client because that is the client's weaker side. Question 10. The home healthcare nurse is caring for a client who has epilepsy. While the nurse is providing care, the client has a seizure. Which intervention would be most appropriate to prevent an injury to the client? Option A, loosening clothing around the waist. Option B, asking the client to state where they are. Option C, lowering the client to the ground. Option D, placing a pillow under the client's head. The correct answer is option C, lowering the client to the ground. 3. Question 11. The nurse is participating in a disaster simulation that involves a school bus accident. The nurse is assigned to care for the following 4 clients in a rural hospital's emergency department. Which client should the nurse see first? Option A, the client with a penetrating abdominal wound. Option B, the client with multiple facial abrasions. Option C, the client with an open humerus fracture. Option D, the client with a 3rd-degree burn to the arm. The correct answer is option A, the client with a penetrating abdominal wound. 1. Question 12. A client with a known large abdominal aortic aneurysm develops a sudden change in level of consciousness and tachycardia. The client's blood pressure is 72/48. What should the nurse do first? Option A, activate the hospital's emergency response team. Option B, page the client's healthcare provider. Option C, conduct a complete head-to-toe physical assessment. Option D, obtain a 12-lead electrocardiogram. The correct answer is option A, activate the hospital's emergency response team. 1. Question 13. The nurse is caring for a client with a medical history of peripheral artery disease, hypertension, and smoking. The client reports severe pain in the right lower leg that started very suddenly and did not get better after receiving an analgesic. What action should the nurse take first? Option A, check the client's pedal pulse. Option B, offer the client an ice pack for the pain. Option C, administer an additional dose of the analgesic. Option D, notify the healthcare provider. The correct answer is option A, check the client's pedal pulse. 1. Question 14. A client presents to the emergency department with a prolonged asthma attack that did not resolve after the client used a metered-dosed inhaler at home. Which medication should the nurse plan to administer first for this client? Option A, oral prednisone. Option B, fluticasone inhaler. Option C, intravenous azithromycin. Option D, nebulized albuterol. The correct answer is option D, nebulized albuterol. 4. Question 15. The nurse on a postpartum nursing unit is receiving report about a client who had a normal spontaneous vaginal delivery the night before. The client has been passing golf ball-sized clots on her peri-pad for the last few hours. The client's most recent blood pressure is 88/56, and her heart rate is 118. The nurse enters the client's room and notices blood oozing from her intravenous insertion site. Which action should the nurse take first? Option A, notify the client's healthcare provider. Option B, palpate and massage the client's uterus. Option C, perform pericare and change the client's peri-pad. Option D, encourage breastfeeding to promote uterine contractions. The correct answer is option A, notify the client's healthcare provider. 1. Question 16. The nurse is reviewing vital signs documented in the electronic health record for a group of clients. Based on this data, which client should the nurse see first? Option A, a client diagnosed with heart failure who has a SPO. Option B, of 82%.2 a client diagnosed with mitral valve insufficiency who has a blood pressure of 152/88. Option C, a client diagnosed with infective endocarditis who has a temperature of 101.8 degrees Fahrenheit 39 degrees Celsius. Option D, a client diagnosed with atrial fibrillation who has a heart rate of 110 beats per minute. The correct answer is option A, a client diagnosed with heart failure who has a SPO. 1. Question 17. The off-duty nurse witnesses a motor vehicle accident and is concerned that the driver of the automobile may be injured. What should the nurse do first? Option A, consider scene safety to prevent further injury. Option B, check the driver's respiratory rate. Option C, check the driver's pulse. Option D, minimize movement of the driver's cervical spine. The correct answer is option A, consider scene safety to prevent further injury. 1.